Hello. Today we're looking at Session 4, Sustainable Development Goals. Presentation today is from Ireland, a new approach to monitoring the COVID-19 outbreak through geostatistical visualization. So my name is Kevin McCormack. I'm head of the Sustainable Development Division within the Centre Statistics Office. In today's presentation, we'll look at the UNSD ESRI's FIS for SDG program, Ireland's SDG reporting ecosystem, a refocus of the Irish SDG team to COVID-19, Ireland's COVID-19 reporting ecosystem, Ireland's COVID-19 internal hub, continuing work, and then finally summary and key takeaways. So looking here at the UNSD ESRI's FIS for SDG program, the Irish Centre Statistics Office, in collaboration with Ordnance Survey Ireland and ESRI Ireland, are currently participating in the UNSD ESRI Federated Information System FIS for the Sustainable Development Programme. This is an exemplar of both interagency and public-private sector partnerships. This programme commenced in May 2017 with a goal to develop and deploy a new approach for monitoring the UN SDGs using geographic information systems, and we have a tagline, geospatial potential of statistical data. Here we have a visualization of the Irish SDG platform. It's an our SDG reporting ecosystem. On the left, where we get data into the CSO through our stats bank, which is our main dissemination tool. It's a WebPX environment. We're in this environment, geospatial identifiers are added by SDG team to the statistical data within the stat bank. The SDG data is then automatically pushed to the Irish SDG indicators platform. This is on the OSI's, or Ordnance Survey Ireland's GeoHive. This is a national geospatial platform, and it's built within the ArcGIS environment for visualization and download by interested parties. The visualization example here is percentage of road deaths in each of the 26 county geographies within Ireland. The Irish SDG hub is also linked directly to the UN SDG hub, following an FIS for SDG approach. Interested parties can also download the SDG indicator data from the CSO stat bank, and the CSO's SDG division has provided tutorials for R, Python, and ArcGIS for visualization of the data. The visualization of the data here on the bottom is the visualization example is the number of deaths due to circulatory system, again in each of the 26 geographies within Ireland. In terms of the COVID-19, we refocused the Irish SDG team to this. So the Office of the Chief Medical Officer, or CMO, has formed the Irish Epidemiological Modelling Action Group, the IMAG, to monitor and model the outbreak of COVID-19 in Ireland. The IMAG report directly to the National Public Health Emergency Team, NEPHET. In response to the coronavirus disease, COVID-19 outbreak, the Centre Statistics Office, in collaboration with Ordnance Survey Ireland, OSI, and Department of Housing, Planning and Local Government, and the All-Ireland Research Observatory in Maynooth University, along with ESRI Ireland as technical partners, rapidly developed a national COVID-19 data hub on the GeoHive platform. GeoHive was identified as the state's geospatial data platform in the Public Service Data Strategy 2019-2023. For this particular action, this work has been designated as the Geospatial Response Coordination Group, big word, GH COVID-19 org, CG. This group is part of the IMAG. Here we're now looking at we'll now look at the COVID-19 reporting ecosystem. The microdata that we're getting is now sourced by the CSO using the 1993 Stats Act from health authorities. The CSO then provides anonymized statistical data with geospatial identifiers to inform the national external-facing Irish COVID-19 hub, a dashboard built within the ArcGIS environment on the GeoHive and pandemic modelers for further analysis. Within the GeoHive environment, there are also a number of restricted access dashboards. Example of two such dashboards are presented here. The first is the visualization of traffic volumes passing road sensors around the Greater Dublin area, the capital of Ireland. This was developed for our policing service to monitor traffic volumes during periods of lockdown. The second is a dashboard built to monitor responses of municipalities to calls from public for support. There's also restricted access internal COVID-19 hub, which provides additional information. This ecosystem is an example of the UNECE's Generic Statistical Business Process Model, the GSBPM, and the UNGGIM's Integrated Geospatial Information Framework, IGIF, working both independently and side to side. You have seen an image of the public version of the National COVID-19 Data Hub. The National COVID-19 Data Project partners use best practice methodologies and governance structures to ensure the appropriate overall management of the project and its data. There is an internal version of this National COVID-19 Data Hub that contains additional data, some of it sensitive. This internal site is only accessible in a secure manner by authorized individuals. Some examples of the data in this internal hub are hospital admissions and discharges by date, age, and gender of patients, ICU bed, occupied by age, gender, dates of admission, and discharge of patients, and this data is available for each hospital in Ireland. Infections reported by geography are at Census Electoral Division, or EDs, of which there's 3,409 geographies, and are classified by date, age, and gender. We also have testing dates of referral, test, lab results, also the geography ED of the individuals tested. Throughput of testing labs by date. The CSO has sourced this data from our health service executive through their Stats Acts of 1993. In continuing our work, we're going to deepen relationship with health data providers, support key national decision makers with the authoritative geostatistical data for evidence-based decision-making to inform Ireland's recovery phase of COVID-19, expand the volume of key data and visualization tools, these will be apps, develop key national stakeholder story maps on the national COVID-19 response, develop additional geostatistical public and internal national dashboards. Here, what we have is an animation, and this animation refers to community hospital networks. There's 96 of these networks in Ireland, and they contain around 500 or 50,000 individuals, should I say? Yeah. So this animation is the first time this particularly CHN geography has been released, and the animation starts at the beginning of February and to the end of July. We will be updating this animation going forward. We also then have a story map for further dissemination, and the story map we're developing is a slider story map, and it's containing data relating to COVID-19 cases at rates per 100,000 of population, again at the electoral district level, 3,409 geographies. There will be 5 maps, and in each map there are 2 sets of data. The map on the left in each of the 5 maps contain data from the 20th of the 6th, 2020, while the maps on the right will contain data from the 29th of July, the 5th of August, the 12th of August, the 19th of August, and the 26th of August in each map respectively. To view these maps from one time period to the next, you simply pull across the slider, which is the arrows at the center of the map from left to right. The left map contains the data from 20th of the 6th in each map, while the map on the right contains data from different dates outlined below, which is the ones we've already given you. To view the legend, you basically click on an icon to the left. The example we have here is the 20th of the 6th, 2020 on the left, and on the right is the 5th of the 8th, 2020. The SDG program has resulted in the development of a close and successful relationship between the statistical and geospatial communities in Ireland. And an associated, the SDG ecosystem was quickly refocused to measure and monitor in Ireland, and also to support the complementary nature of the UNECE's GSBPN and the IGIF is clearly presented in the Irish COVID-19 ecosystem. Geostatistical dashboards, animation, and story maps are innovative dissemination channels and are well received by various levels of data users as well as the general public.